So let's move ahead with the definition of sepsis. As per the literature, sepsis is a life-threatening organ dysfunction caused by dysregulated host response to infection. In this definition, every word is very, very important. As it says, it's life-threatening. It is an organ dysfunction which is caused by dysregulated host response specifically to infection. So everything has to mark it or label it as sepsis. Now coming to the septic shock. Septic shock is basically a part of sepsis in which there is circulatory and cellular metabolic dysfunction. It is associated with a higher risk of mortality as compared with sepsis alone. And clinically, it can be identified by we have to maintain a MAP or mean arterial pressure of 65 millimeters mercury or greater than that, a serum level, lactate level of greater than 2 millimoles per liter or more than 18 milligram per deciliter in the hypovolemia. Because these things can also be present in a case of hypovolemic shock where the blood pressure is low and the lactate is higher. So they have specifically mentioned in the absence of hypovolemia. The definition speaks itself about the severity and the higher rate of mortality in this condition. So this is a very interesting picture showing the septic 6. It was initially the guidelines. It was a goal-directed therapy which we used to do in a case of sepsis once identified. In emergency, it was always asked to start oxygen, collect the blood cultures and the urine cultures or the sputum culture or the wound swab for culture wherever indicated, start the antibiotics as early as possible, give a fluid challenge to the patient in sepsis or septic shock, measure the lactate and the urine output. So this was the sepsis 6 or the 6th bundle for treating the septic patient. But we have moved ahead from the goal-directed therapy towards patient care as a whole. So nowadays, it is recommended to use qSOFA when it is compared with CERT or MUSE or a single screening tool for sepsis or septic shock. As such, we don't have a marker, or I should say, there are many markers like pre-sepsin or synopsin which are there, biochemical markers to identify sepsis as a point of care testing, but these are not yet approved by the guidelines or the surviving sepsis guidelines, I should say. The best tool to identify sepsis in bedside is qSOFA. There is a strong recommendation and moderate quality of evidence to support qSOFA in identifying sepsis as a bedside tool. So qSOFA is the qSOFA. So what is it? We'll go ahead and check it. qSOFA or Quick Sequential Organ Failure Assessment. Earlier, SOFA score was used, which was there used in the ICUs because a lot of biochemical and laboratory results are needed to fulfill or to get a complete SOFA score. But qSOFA is something which can be done bedside for identification of sepsis patients. So it's a very simple mnemonic. Remember HAT, always on the top of your head. So that is hypotensive, systolic blood pressure of less than 100, altered conscious level, that is GCS of less than 15, tachypnea or respiratory rate of more than 22. If 2 out of 3 criteria is present, hypotension, altered mental status, tachypnea, any 2 out of these 3 is present, you can label it, or you can have a provisional diagnosis of sepsis. The predicted mortality in this case is more than 10, and it is highly specific for diagnosis of sepsis. Earlier, it was used to label as CERT for the identification of sepsis, which is systemic inflammatory response syndrome. The criteria for this is temperature of less than 36 or more than 38 degrees Celsius, heart rate of more than 90, respiratory rate of more than 20, or a PCO2 of less than 32. Because when the patients are septic, they have a faster breathing rate and the PCO2 washes out. So that is why the PaCO2 decreases, that is less than 32. and a WBC count of less than 4,000 or more than 12,000. 2 out of 4 criteria mark it as sepsis, but we refrain ourselves from using search criteria at present, and we mainly focus on qSOFA, which is HAT, hypotension, altered mental status, and tachypnea. So this is the National Early Warning Score or the NEWS score. Nowadays, modified NEWS score is also present, which can be used. We can refer to the table, we can hang it in the ward, in the emergency department. But again, I will stress upon using qSOFA as a bedside tool for identification of sepsis.